Good evening, ladies and gentlemen. A very warm welcome to each and every one of you from wherever you are tuned in. On behalf of Greenwald Kenya and Greenwald International Business School, I'd like to take this earliest opportunity to welcome you to this session. It's a very important and also empowering session titled Protect Yourself Against HIV and AIDS. This topic or this session is very vital. It's a vital conversation that could or is meant to change lives. And today we are going to be diving deep into the causes, symptoms, risk factors, and management of HIV and AIDS. And our goal is simple: to inform and empower you with practical knowledge that is going to help you to protect yourself, to prevent this scourge, and also give you knowledge on how to holistically take care of your well-being. And this evening, we are honored to have with us Ms. Shadrin, who is an esteemed international trainer with Greenwald International Business School. And she brings with her a wealth of knowledge and passion to this topic. So please prepare yourself, and I hope you will also keep your phones muted to avoid interruptions, but feel free to engage in the chat box and also prepare questions. Maybe at the end of the session, you can ask. So please help me to welcome Madam Shadrin to take us through tonight's session. Madam Shadrin, the floor is yours. Please take us
Thank
through.
you. Now I'm going to share my screen. Oh, you can see the PPT slide, right?
Yes, we can see it.
Thank you. Good evening, ladies and gentlemen. Great to see you again on the meeting. Today's topic is about HIV and AIDS. Let's go through the details now. We know that HIV remains one of the most significant global health challenges, including AIDS, with millions of people affected worldwide. And Africa remains the most affected region by the HIV, the virus, or AIDS, the syndrome, accounting for 2/3 of global infections. Despite advances in treatment, prevention remains the most powerful tool against this virus. So understanding how HIV works, how it leads to the AIDS, and how to protect yourself can really save lives. Well, now let's get to know HIV, how the virus works. The human immunodeficiency virus is a retrovirus that attacks the body's immune system, specifically the CD4 cells, which are T helper cells belonging to our immune system. And they play a crucial role in coordinating the immune response. Over time, HIV can destroy so many of these cells that the body can't fight off infections and diseases, thus leading to AIDS, the acquired immunodeficiency syndrome. Like I mentioned, HIV is a retrovirus. Then what is it then? Well, a retrovirus is a unique type of RNA virus that has the ability to integrate its genetic material into the DNA of a host cell. This process, which involves reverse transcription, makes retrovirus fundamentally different from other viruses, and we will explain this thoroughly later. Uh, Retrovirus are hard to treat because their integration into the host DNA makes it different to eliminate without harming the cells, the normal cells. And their high mutation rate allows them rapidly evolve to escape drugs and immune responses. Also, their latency allows the dormant proviruses to reactive years later. These, for example, the HIV reservoirs. So let's see how HIV infects the body. It's a step-by-step breakdown. And the first step would be entry into the body. HIV enters through the blood or semen or vaginal fluids, rectal fluids, or breast milk. Common transmission routes include unprotected sex, shared needles, mother to child during birth or breastfeeding. So the next step, step 2, is binding to the CD4 cells in our immune system. The virus attaches to those CD4 receptors on immune cells using its GP120 protein or glycoprotein. And a second co-receptor is needed for full entry. Actually, it's a very complicated mechanism, right? Then the viral envelope fuses with the host membrane, releasing its RNA inside. For better understanding, the envelope is a lipid membrane derived from the host cell, embedded with viral glycoproteins that help the virus enter cells. So the third step is reverse transcription. Like I said, HIV carries RNA, the single-stranded material, the genetic material of the virus, which it converts into double-stranded DNA using an enzyme called reverse transcriptase. This process is error-prone, causing frequent mutations. And that is why HIV develops drug resistance. The fourth step is integration. At this stage, the viral DNA is transported into the nucleus. Then the enzyme integrates, inserts viral DNA into the host cell's chromosomes, creating a provirus, which is a permanent viral genetic material. The provirus can remain dormant for years. This allows HIV to hide indefinitely in infected cells. Now we go to the step 5, replication and the assembly stage. When activated, the host cell treats the viral DNA as its own and reads the viral DNA and also makes new viral RNA, which is the genetic material for the new viruses. And also they make viral proteins, including structural components like the envelope and enzymes, the protease enzyme, which cuts long protein chains into functional pieces. So the sixth step is budding and immune system destruction. At this step, the infected cell produces new HIV particles, which bud off from the host cell, stealing part of its membrane to form their envelope. Then these new HIV particles infect more CD4 cells. Over time, the immune system weakens, leading to the acquired immunodeficiency syndrome, the AIDS. So this is how HIV infects the body step by step. Now let's see the stages of progression from HIV to AIDS. It occurs in three main stages. The first one is acute HIV infection, the primary infection. It occurs 2 to 4 weeks after exposure. The virus rapidly replicates, spreading through the body, and the immune system detects HIV and produces antibodies. And the viral loads, meaning the amount of HIV in the blood, is very high, making the person highly infectious. And the CD4 cells decline sharply, but may rebound slightly. The body cannot fully eliminate the HIV virus, thus leading to chronic infection. The symptoms at this stage is very similar to flu. Symptoms like fever, fatigue, swollen lymph nodes, sore throat, rash, muscle or joint pain. Some people may have no symptoms at all. So the second stage is chronic HIV infection, or we call it clinical latency stage. It can last years to decades, with an average of 8 to 10 years without treatment. At this stage, HIV continues to replicate at lower levels because it is controlled by our immune system. There is gradual decline in CD4 count because our immune system weakens over time due to the attack of the virus. And there are no severe symptoms in early stages, but persistent swelling of lymph nodes may occur. So the key features at this stage are without antiretroviral therapy, the ART therapy, the virus slowly destroys CD4 cells. People may feel healthy, but can still transmit HIV. Viral load increases as immunity declines. Then the final stage of HIV infection is AIDS. It occurs when CD4 count drops below 200 cells per cubic millimeters. The normal range is between 500 to 1,500. The immune system at this stage is severely damaged. Opportunistic infections and cancers appear. These infections wouldn't affect someone with a healthy immune system, but it affects people with AIDS. Symptoms of AIDS include rapid weight loss, we call it wasting syndrome, and extreme fatigue, recurring fever, night sweats, chronic diarrhea, persistent white spots in mouth, the oral thrush. Severe infections, including tuberculosis, pneumonia, and neurological issues like memory loss, confusion, also cancers. Without treatment, life expectancy is around 3 years. While with with antiretroviral therapy, the progression to AIDS can be prevented. Well, let's see how what makes an infection opportunistic. These infections are called opportunistic because they rarely cause disease in healthy people, and they seize the opportunity. To infect when immunity is very low, and they can reactivate from previous latent infections. They often indicate advanced HIV disease, the AIDS. So common opportunistic infections include bacterial infections, viral infections, fungal infections, and parasitic infections, as well as cancers associated with HIV. In bacterial infection, uh, tuberculosis is the leading cause of death in HIV positive individuals, while Mycobacterium avium complex causes chronic fever and wasting syndrome. The bacterial pneumonia is often caused by Streptococcus pneumoniae. In viral infections, cytomegalovirus causes retinitis, even blindness, and it can cause colitis. While herpes simplex virus it causes severe oral or genital ulcers. The varicella zoster virus causes severe shingles or disseminated chicken pox, while the GC virus causes progressive multifocal leukoencephalopathy, the disease affecting your brain. In fungal infections, the pneumocystis pneumonia is the most common AIDS-defining infection, while candidiasis thrush is the white patches in the mouth or esophagus. The cryptococcal meningitis is a life-threatening brain infection. While in parasitic infections, the toxoplasmosis is brain abscesses, which can be from cat litter exposure. While the cryptosporidiosis can cause severe chronic diarrhea, while the isosporiasis can cause watery diarrhea and wasting. In HIV-associated cancers, the Kaposi sarcoma is skin or visceral tumors caused by HHV-8. Lymphomas like non-Hodgkin's and primary central nervous system lymphoma. While cervical cancer can also occur, include aggressive forms linked to human papillomavirus. So these are all the opportunistic infections happened in HIV or AIDS. Let's see what tests can be used to detect those viruses or the disease. Once you have been diagnosed with HIV, your doctor will advise you start treatment immediately to bring the virus under control. You will not only be counseled on how to take your drugs correctly, including dietary restrictions, but also advised on ways to maintain optimal adherence. You will also be given baseline blood tests called a CD4 count and viral load, against which your response to treatment will be measured. And you will be asked to return every 3 to 6 months to have these blood tests repeated. The CD4 count measures the number of CD4 T cells in your blood. These cells are responsible for instigating the immune response and are the very cells that HIV targets for infection. As HIV kills off more and more of these cells, the body becomes less able to defend itself against otherwise harmless opportunistic infections. The CD4 count measures the status of your immune system based on the number of CD4 T cells in a cubic millimeter of blood. So a CD4 count is broadly categorized as follows. Normal range is 500 or above. The in state of immune suppression, 200 to 499 cells per cubic millimeters. In people with AIDS, the CD4 cells is under 200 cells per cubic millimeters. So with early ARDS, the antiretroviral therapy, the CD4 count should increase to normal, to near normal levels. And people who delay treatment until the disease is advanced generally have a harder time rebuilding their immune system. So early treatment matters the most. While the viral load measures the actual number of viruses in a sample of blood. The viral load can run well into the millions if left untreated. While if treated appropriately, the viral load can be reduced to undetectable levels. Undetectable does not mean that the virus is gone. Although the virus may not be detectable with blood tests, there will be many hidden in the tissues throughout the body, known as viral reservoirs. If the ART, the antiretroviral therapy, is stopped, these latent viruses can reactivate it and lead to a rebound in the viral load. The viral load can also help determine if a treatment is failing due to drug resistance. Drug resistance most often occurs when you don't take your drugs as prescribed, but it can also develop naturally after many years of treatment. If drug resistance occurs, the viral load will gradually creep up even if you are taking your drugs as prescribed. When the viral load indicates that a treatment has failed, your doctor will begin the process of selecting a new combination of drugs for you. Now we come to the treatment part. Treatment is vital for people with HIV because without the treatment, HIV typically progresses to AIDS in 8 to 10 years. While with the treatment, people with HIV can live long, healthy lives and never develop AIDS. The treatment focuses on suppressing the virus, restoring immune function, and preventing complications. And the primary treatment is antiretroviral therapy, like I said, but additional strategies are needed for advanced AIDS cases. There are drugs a doctor may prescribe along with ART if you are at risk of an opportunistic infection. These preventive medications, referred to prophylactic, are commonly prescribed when your CD4 cell count is below 200 or 100. These may include daily oral antibiotics to prevent severe infections like the pneumocystis pneumonia or Mycobacterium alveolum complex. Antiretrovirals are so named because HIV is a retrovirus, like I mentioned. Antiretroviral drugs do not kill HIV directly. Rather, they prevent the virus from making copies of itself by blocking stages in the virus life cycle. So the goal of antiretroviral therapy is to reduce viral load to undetectable levels and preserve CD4 counts to lower risk of infections. So the ART typically consists of 3 drugs used in combination from at least 2 different classes to prevent resistance. To make it easily understand, drug classes include NRTs, INSTIs, etc. The NRTs is short for nucleoside reverse transcriptase inhibitors, which blocks HIV's reverse transcriptase enzyme. Those drugs including tenofovir, TDF or TAF, emtricitabine, FTC. INSTIs is short for integrase strand transfer inhibitors, which stops HIV DNA from integrating into human DNA. These kind of drugs, including dolutegravir, DDG, bictegravir, BIC, etc. And according to the WHO and CDC guidelines, the most common recommended first-line ART regimens is bictegravir, including the bictegravir from the INSTIs class, plus the emtricitabine from the NRTs class, plus tenofovir from the NRTs class. So there are 3 drugs in this combination. People need to start ART immediately after diagnosis, regardless of the CD4 count, because earlier treatment equals to better long-term outcomes. As all drugs can cause side effects, so do antiretrovirals, and in rare cases, be severe. Short-term side effects may include headache, fatigue, nausea, diarrhea, insomnia, and even a mild rash on our skin. These tend to resolve within a few weeks as your body adapts to the treatment. Other side effects may be more severe. Some can occur soon after treatment is started or develop weeks or months later. The side effects can vary by the drug class and in some cases by the individual drug. Among the concerns, the side effects might include acute kidney failure, central nervous system disturbances like dizziness, abnormal dreams, loss of balance, and disorientations, or drug hypersensitivity, or lactic acidosis, which is rare but potentially deadly buildup of lactic acid in the bloodstream. Or you might have a lipodystrophy, meaning that you have fat-related side effects. Or you can have liver toxicity, or peripheral neuropathy, which affecting your peripheral nervous system, causing the pain or numbness in your muscle, right? Those information are about the treatment of ARDS and the side effects of ARDS that may occur. Well, let's see the healthy lifestyle practices. Except above mentioned treatments, healthy lifestyle practices are also advised for people with HIV, irrespective of the CD4 count. This helps reduce the risk of non-HIV associated illnesses such as heart disease and certain cancers that occur earlier and more frequently in people with HIV. Healthy lifestyle choices for people with HIV include eating a balanced diet, low in saturated fats and sugar, maintaining a healthy weight, exercising regularly, keeping your blood pressure and cholesterol under control, getting the recommended vaccination, getting the recommended cancer screenings, and also quitting cigarettes. These are all recommended to keep you healthy. Meanwhile, Greenwald Health products also help. A power capsule is a product for HIV or AIDS. The key ingredient of a power capsule is Ganoderma, which is regarded as the mushroom of immortality. Chinese and Tanzania professors and scientists had carried out a pilot clinical trial on the therapeutic effect of Ganoderma preparations on AIDS patients in Africa. The preliminary results showed that when Ganoderma was used in conjunction with antiretroviral medications, AIDS patients' weight gain, CD4 cell number, red blood cell level, and other indicators were significantly increased as well. The effect is twice that of patients who were only given the retrovirus group. Ganoderma is not only effective in preventing the onset of cancer, but also aids in discouraging cancer cells spread. It also contributes to lowering the risks of relapse thereafter. So the second ingredient of a power capsule is Riddick's astragalus. American scientists have found through long-term research that Riddick's astragalus contains a substance, TAT2, which can effectively inhibit the virus replication of HIV and has a special effect on the treatment of AIDS. In addition, Radix astragalus has proven effective in treating immune diseases associated with chronic infections and viral infections. The third ingredient, honeysuckle extract, has shown a moderate inhibitory effect on the HIV virus and has an immune-enhancing effect as well. Red ginseng curbs the replication of HIV and possesses powerful anti-cancer properties because of its ability to inhibit tumor growth, while sea buckthorn extract inhibits the growth of pre-existing tumor. So these powerful ingredients make a power capsule a star product for people combating HIV or AIDS. So let's see another two products. HIV or AIDS can cause malnutrition directly and also indirectly through opportunistic infections. So HIV keeps the immune system in a hyperactive state, burning more calories and increased metabolic demand. On the other hand, viral proteins damage mitochondria, which is the energy producers in our cells, reducing energy efficiency. Meanwhile, HIV triggers cytokines that break down our muscle and fat. So people living with HIV or AIDS could have thrush in the mouth. These greatly affect their appetite. They could also have infectious diarrhea and tuberculosis. These could disturb the absorption of nutrients. And to make things worse, drugs used in antiretroviral therapy have also been recognized to lead malnutrition in many ways. Most people at the late stage of HIV or AIDS develop wasting syndrome. So malnutrition depresses every aspect of immune function. Deficiency of key micronutrients like iron, folic acids, zinc, selenium, and vitamins A, C, and D adversely affects immune function. HIV already destroys the immune system, so malnutrition makes things worse. That's why we can see that malnutrition and AIDS are a deadly duo. So for people with wasting syndrome, to provide them vitamins, minerals, proteins, and essential fatty acids, even carbohydrates are important. If they can swallow, we can recommend spirulina plus capsule. If they have difficulty swallowing, we can recommend them the liquid food, such as blueberries super nutrition. This is an all-in-one product that provides you carbohydrates, protein, essential fatty acids, vitamins, minerals, and dietary fibers, phytochemicals, including anthocyanins and other antioxidants. When our immune system is struggling with the viruses or the cancerous cells, the immune cells produce free radicals on purpose as a chemical weapon to kill those viruses and cancerous cells. But long-term exposure to the free radicals results in oxidative stress, which exacerbates infections and cancers. So the antioxidants in spirulina plus capsule and blueberry super nutrition may help neutralize the free radicals and alleviate the oxidative stress. Greenwood products are friendly when used in conjunction with orthodox anti-HIV medications. So these are another recommendation. Though sounds horrible, HIV or AIDS is preventable. But before this, let's get to know how HIV is transmitted and how it's not. The high-risk transmission routes include unprotected sex, blood exposure, sharing needles by drug use, tattoos, or piercings, or needle stick injuries. For example, the healthcare workers are prone to this. Also, it can be transmitted through mother to child, during pregnancy, birth, or breastfeeding. And HIV is not spread through saliva, sweat, tears, unless mixed with blood. So you cannot get HIV from kissing unless both partners have open bleeding sores inside the oral cavity. And it is not transmitted through casual contact like hugging and shaking hands. And it is not transmitted through mosquito bites and toilet seats, sharing food. So these are how HIV is transmitted and how it is not. Then how to protect yourself. We suggest that you use protections. Latex or polyurethane condoms reduce HIV risk by 80 to 95%. A second choice is pre-exposure prophylaxis, the PrEP in short. For HIV negative people at high risk, you can use this PrEP method. The Truvada and Descovy are daily pills that lower infection risk by 99% if taken correctly, while Apretude, which is an injectable PrEP, it is a new alternative. Taking one shot every 2 months is fine. Is okay. Another method is post-exposure prophylaxis, which is known as PEP. This is emergency medication that is taken within 72 hours of possible exposure. The ART must be taken for 28 days to block infection. Also, avoid sharing needles. Needle exchange programs provide sterile syringes. Medication-assisted treatment, MET, helps reduce injection drug use. And also get tested and know your partner's status. The rapid HIV tests gives results in 20 minutes. Like I said, undetectable means untransmittable. So people on effective HIV treatment cannot transmit the virus. Also, male circumcision helps for heterosexual men. It reduces HIV risk by 60% in high prevalence regions. So these are all the preventative measures people can take to prevent the virus infection or AIDS. Like I said, HIV is preventable, and even if contracted, it is treatable. By understanding how the virus works and using proven prevention tools, you can take control of your health and stop the spread of the HIV virus and AIDS. So stay informed, stay safe, and empower others with knowledge. Uh, we thank you very much for joining us today. And that's all for the presentation part.
Thank
Okay.
you very much, Madam Shadrin, for that wonderful presentation. Indeed, it is timely and insightful because HIV has ravaged societies and communities around the world. And for us in Africa, we have felt the brunt of this problem. And this information that you've shared about how it is caused, the symptoms, how to manage it, and even the greenwald products that can be used is quite important. And in fact, I've seen someone on the chat box has asked whether the products that you've mentioned can be used in conjunction with the ARVs, or they can replace the ARVs. Maybe you can, I don't know whether you can answer that.
Yeah, thank you for the question. Our greenwald products can be taken in conjunction with the antiretroviral therapy, but it cannot replace the therapy. So the therapy is a must for people with HIV or AIDS. And our products can help, control the situation to make things better. Thank you.
Thank you very much. I hope the person who had asked is Ibrahim. Ibrahim, I hope that you've been answered well and you've taken the advice from our trainer. So to the rest of you, I want to thank you for joining the training and for staying the whole length of the training. I hope that the information you've gotten will be useful for you for protecting yourself, and for those who've been infected, they know how to manage it. And you can also now take this information and help your customers, your clients, with information that they can use to improve the quality of life that they live. At the moment, HIV is not really a death sentence. So I hope that you can pass that on to those people that you're dealing with, that they can manage if, in case by bad luck, they end up getting this problem, this virus. It is not the end of the world. There are therapies, there are products that can be used to improve the quality of life, and many people have lived quite a long life. So thank you very much. Wishing you all a good night. See you again next time. I'll unmute everyone so that we can say our goodbyes and our good nights till we meet in our next session. Thank you very much, John.
Thank you. Thank you, everyone.
Good night, Mr. Fred.
Good night.
Good night.
Good night.
Good night,
Thank
everyone.
you. Good night.
Mark, good
Good
night.
Night, Shadrin.
Good night.
Good night,
Sharing.
Wendy, good
everyone.
night.
Please
Mwenda.
support. Oh,
Good night. Good night, Sister
Leah
Freddy.
Waudi, good night.
Good night.
Audi.
Good night.
Ruth Maingi, good night. Tabitha, good night. Joseph Mbu, good night.
Good night.
Gertrude Kericho, good night.
Bilha, good night.
Good night, everyone.
Jerop Nakuru, good night.
Bilha, good night.
Thank you.